Hi, all. My name is Nicole McFarland of the Oily Ponderosa, and I wanted to jump on here today to talk about how to use essential oils. I know I've got content that talks about why I recommend the usage of essential oils. And I know that we all know that you can use essential oils in one of three ways: aromatically, topically, internally. And I want to do a series that talks about how the various hows you can use essential oils in those three ways. Excuse me. Tongue tied. Hello. Anyway, so today we're going to talk about topical. In a few days or maybe a week from now, I'll talk about how to use them aromatically, and then I will talk about how to use them internally. So if we think about topical usage, I know, right? We get an essential oil and we just throw it on, or we mix it in a body butter that we might be making and we can apply them that way. But there are many more intentional reasons or ways that you can use essential oils. So first, the first thing I want to talk about is, and I'm going to share so you guys can see this. I want you to know how to get the oil out of the bottle. So right now I'm sharing with you the orifice reducer, which is this translucent top that you see on essential oils. You'll see a big hole in the center, which is the vent hole. That's really to push air into the bottle to allow the oil to come out of this tiny, tiny little hole here. Now, when I get an essential oil, I generally turn this hole towards the label so that every time I open my essential oil, I know exactly where this little hole is and I know exactly how I'm going to get my oil out. Now, here's a tip. If for whatever reason you get your essential oil or you're wanting to make, let's say, a capsule and drop an essential oil, a single drop into that capsule, and it's a full bottle and you're like, some of this oil might be thin and might pour out really fast, you can turn that bottle around. So you want to pre-position your hole to in front of your label. And actually, let me grab a bottle so you can see. So you want to pre-position that mini hole in front of this label so that every time I go and want to get some joy out, I just turn it and the drop comes out. Or if I'm trying to be very specific about how much oil comes out, I'll turn this joy cap around, or I'll turn that label around, have my hole positioned at the top, and then I will work to get a drop of oil out. This will meter better how fast your oil comes out. Because like I said, if it's a thinner oil like frankincense, it'll keep dropping out really fast. But if you turn it slightly and you rest your hand properly, you can get that drop to come out slightly slower. So that is one thing I wanted to make sure you knew first before we talk about how we're going to use an essential oil topically. So there are multiple ways to use essential oils topically. There are multiple application sites, excuse me. So one of my favorite sites is lymph sites. And I'm going to go through each of these individually, but I want to give you the list first so you can hear the list. And if you're like, I'm done with this video, you can go, right? You're like, I got all the sites, I'm out of here. This isn't really all the sites. This is just some really top sites for me. So it's over your lymph nodes, on thin skin. So like inside your wrist area, inside your thigh, your neck is also a thinner skinned area. I also apply them on location. So I might apply essential oils over an organ. So if I'm having an issue and I feel like I need some support on a particular organ, say my kidney, then I'm going to rub that oil on over top of my skin, but over top that sits on top of my kidney area. So that's on site. And then if I, like, as an example, if I get a cut, I'm going to put lavender, or some people use geranium or whatever on that cut. I'll dilute the oil as indicated on the bottle, but I'll drop that oil plus a carrier on location. And I might put a Band-Aid over it and let the oil support me and do their work while it's bandaged up. There are VitaFlex points. VitaFlex points are on are on your palms, on the underside of your feet, soles of your feet. I almost lost that word for a second, on the soles of your feet and on your spine. So there are multiple VitaFlex points that you can use as well. Neural auricular points. So that's your ears. And I'm going to show you guys all this. Again, this is just a list. And then, of course, there's your spine. Your spine is in alignment with kind of the VitaFlex points, but not necessarily. So there's your spine that you can also use. So let's talk about the lymphatic system. I'm going to show you another visual for lymphatic so that we can, as I'm talking, you can kind of see what I'm talking about and where. So here we go. It's currently covered. 1 second, guys. All right. Our lymphatic system. So of our lymphatic system, there are over I've seen resources say there are 800. I've seen sources say there's 700, but let's just call it what it is. There's 700 to 800 lymph nodes in your lymphatic system. And your lymphatic system is a network. As you can see, all of these green areas represent your lymphatic system. It's part of your circulatory system. It's not a closed off system. So I particularly enjoy putting essential oils on my lymph nodes in my neck. A third of your lymph nodes are in your neck. You can see another congregation of lymph nodes underneath your armpits, and then in your groin area is another congregation of lymph nodes, and then also there's a small network of or congregation of lymph nodes in your knees. I particularly apply several essential oils either on my neck for the most part. I'll also apply them on my groin if necessary, and then on my pits as well if necessary. The reason why I like applying essential oils on my lymph nodes is because your lymphatic system is essentially part of your immune system. Not essentially, it is. It's part of your immune system, and by applying essential oils to those lymph nodes, it's helping. From my experience, or from the things that I've researched, where your lymph nodes is where your fluids are passing back through into your blood, right? So we're processing a lot of junk in our lymph nodes. And as a result of that, I'm going to want to use that network to make sure that my essential oils that are there to help and boost and support my system, or that as soon as I apply it there's an electrical charge, and it's like my lymph nodes are awakened and are listening to the oils that I'm applying to my body. That's how I articulate it from a non-medical professional perspective. So I really, truly like applying my oils over my lymph nodes. And again, it's going to get into the oils will get into your system either way. This is just one of my favorite locations for where I apply a lot of my essential oils, depending upon the reason why I'm using them. So as we talk about locations, VitaFlex, I'm going to show you a chart, and I'm going to show you multiple for VitaFlex. Because VitaFlex is an entire network across your body. So we're going to spend a little bit more time here on VitaFlex points. So let's talk about this. And right now I'm on feet, but I'm going to move over to, so we talked about, I have a dialog box in my way, excuse me. All right, so we talked about VitaFlex points being in your hands and VitaFlex points being in your feet. So as this diagram indicates, if you're wanting to help support your systems, be it your eye, then on your left hand or your right hand, you can apply oils to your first two fingers, and it will help. It will communicate from your fingers to your eye. It's a network. So your VitaFlex point is all built on, it was created thousands of years ago. It was perfected in 1960 by Stanley Burroughs. But it's the essential thought is that applying essential oils in these areas, it's creating an electrical charge. That electrical charge is going through the pathway from the VitaFlex point to the point that you're wanting to reach, and it's identifying where there's a breakdown in the circuit. And so the oils are then helping your body act on that breakdown or miscommunication or broken channel within the circuit to help support your systems in various areas. So on your fingers, there's eyes, there's ears, you've got brain, pineal, and pituitary. You've got your nose here on the side of the thumb. You've got your thyroid on the base of your thumb, and then of course your adrenal glands. So we talked about topical use, and we'll talk a little bit more about specific oils and topical use, but I'll use one as an example. So Endoflex is a popular essential oil blend that Young Living provides or sells, and it is a great support for your adrenal system. Well, for me, adrenals, it's like you got to go way up here in the middle of your back and hope that you get there, and you're praying that the communication through your skin and through your bone it's reaching your adrenal glands. Well, guess what? You have a direct network and communication opportunity on the palm of your hand, just here on the lower base of your thumb, to help support your adrenal glands. If you want to put your Endoflex there for helping to support your adrenal glands. So this is a little view of hands. Let's get into feet. So feet offer very similar options for communication through the network after application of essential oils. So you'll see you've got eyes and ears and sinuses all on your feet. What's really one of the really cool things for me is because I use one of our serums at Young Living, and that is Progestins Plus. And that serum, one second, doing too much here. That serum can be applied to, let me just make this bigger so I can get rid of some things. All right. That serum can be applied on the inside of your foot. So by applying, the inside of your foot, but it's almost like the inner ankle. And if you'll look at the very bottom of this diagram, you'll see that men and women's reproductive organs, or the communication pathway, is through the inside of the foot or inside of the ankle. So for men, it is the left, and for women, it is the right ankle. So there are some specifics about which ankle and which for which you're using. Now, for me, I apply my Progestins Plus to my ankle, and I rub both my ankles together. So it's not hurting anything, but because the communication is happening with the application of it on my right foot, but I'm also applying it to my left foot as well. So you have some support for your adrenals here in your foot as well. And you've got to follow this diagram. So it's right here, you'll get some adrenal support should you need to use it. Endoflex, as the example we're using for the hands, on the bottom of your feet. So next, we talked about the neuro auricular area. That's your ears. So moving diagrams out of the way again. So in this chart, and it's pretty small, these are available online. You can pull this chart, VitaFlex ear chart, and this will pop up for you. The one that I've used the most is allergy. So I make an essential oil blend that I know will help support, and I can't tell you that it's going to help your allergies. That's not what my intent is. But for me, and to support me during seasonal allergy time, I will apply the little blend that I make on top of my ear, as well as in other areas, but I apply it on top of my ear because the VitaFlex chart indicates that top of the ear will help support you during, for any allergies that I might be experiencing. So I use that point, but there are multiple points that you can use for the ear for different reasons than what you might have seen on the hand and foot chart. So depression is a good, it's like right here on the, not really the top of the ear, but it's a little point on the ear where you can apply oils to help support you if you're having a period of feeling slightly down or depressed. So there are a variety, as you can see, ways that you can use essential oils topically in specific areas that's just not rubbing it on your skin. You're being really intentional, right? You're applying that oil right here on the top of your ear, and you're saying, you know what, go to work. because the VitaFlex chart says that I can. No, but honestly, so that's some of the ways or areas that I apply essential oils that have like direct indicators on where I can apply and why I apply it there or what purpose, if it's purposeful. But then there's other stuff, right? So I talked about Progestins Plus. I apply Progestins Plus on my neck. And I apply Progestins Plus on my neck for the first application of the day because I've got a network of lymph nodes here and I just want my progestins to go in and do its dirty work. I even apply essential oils on my neck as a perfume. So like this Joy, which is a great, I'm actually make a perfume with multiple oils and then I have a carrier inside of it. But if I'm just at my oil rack and I want to throw on something that's going to make me smell good, I'll take a Joy as an example and just apply it to my neck. There's no reason, the lymph nodes aren't a factor in that particular case. I'm just applying it on my neck. If I think about neck and shoulders, if I've got Valor, right? So if I want to apply Valor, which is really good for helping boost confidence, I roll this, and this didn't show you this, but this is a roller, right? So this roller ball, I just roll Valor on my neck. And after the application of that roller, I'm going to take my hand and I'm going to rub this Valor down onto my shoulders and really massage it in. I really massage the Valor in. And this is before any major, if I need to have a meeting coming up and I just need to boost the confidence, I'm going to rub this thing in. I'm going to rub it on my shoulders and it's just going to give me that relaxation and peace. And then I'm going to rub my hands together and inhale. That's part of our aromatic session, but I can do topically and aromatically at the same time. All right. And then wrists and forearms. So I will apply Joy as a perfume on my wrist. This is thin skin here, thin skin on your forearm. I will apply Joy. I apply my Progestins Plus to this area because it's thinner skin. And the whole thought of applying to thinner skin is for faster absorption. So many people will tell you, as an example, feet. They're like, apply oils to your feet because your pores are bigger there. Well, that's slightly not accurate. And it's not accurate because your feet actually have an additional layer of skin on them, just like your palms. So because that skin is thicker than the skin that you're applying, if I use a very thin skin, or if I'm applying on top of my thighs, not my inner thigh, but on top of my thighs where the skin is slightly, it's not thin skin, the absorption is going to be based on the thickness or thinness of your skin. And of course, if you're using a carrier oil along with the essential oil. So if you're using, like, when I say carrier oil, I mean like a jojoba or an almond oil. So it's a fatty oil that slows down absorption as well, which is good in some cases. So as we're talking about feet, and like I've got Rutavala. So Rutavala is a stinky oil. First of all, I apply it to my feet because it stinks to me. Some people love it and it stinks to me, and I want to just put it on my feet, get under the covers and go to bed. But another reason why I use Rutavala on my feet is because it provides sleep support, and that sleep support is going to be helpful for that slower absorption. For sleep support is going to be helpful because it's going to take me to sleep, right? It's going to it's not going to take me to sleep, excuse me. That absorption is going to follow me as I fall asleep naturally and help support me while I'm sleeping. So the absorption is going to be a lot slower than if it were on a thinner part of your skin. There are your temples. So if I'm dealing with, a stressful situation, or I need to there's a lot going on, I'm going to apply Stress Away to my wrists and to my temples. The application of an essential oil to your temples, it's on location, in my opinion, and it's direct, and it's going to absorb into the network of vessels that you have in your temples. And then it's going to, it's going to, as it starts to absorb, it's going to impact what? Your brain is right here. So it's going to impact the vessels here and it's gonna, it's gonna get into your bloodstream, but it's also directly, in my opinion, on location from a brain perspective. So it's gonna help there. And of course, I'm going to continue to smell it. So I'm aromatically also experiencing the benefits of Stress Away essential oil blend through my an aromatic effect. All right, abdomen and chest. So if I'm dealing with congestion in my chest and I want to help support my body healing itself, we've got RC, which is a blend of multiple essential oils. I'm going to take RC as an example, put it into a carrier oil, rub it, and I'm going to apply it over my chest and my lungs. So I'm going to get deep in there. I'm going to make sure that I've applied this oil over the organ that I want the oil to support. So that's another, that to me is on location. Its purpose is to help support my lungs, but at the same time, I'm getting an aromatic experience as well. So that is why I would apply oils to my chest. Now my abdomen, so when I think about lower abdomen, I think about groin area, which again, network of lymph nodes are there. So if I apply something on my lower abdomen, it's on location. So I might be applying something because on my lower abdomen, because I want to support my bladder or my uterus. But I'm also going to apply those oils on my lymph nodes in that same area because I'm wanting it to help support my immune system at the same time, or just support my immune system. And then my upper abdomen, we talked about finding the adrenal glands. I'm like, if I can't reach back here to my back to put oil on my upper back to support my adrenals, well then I'm gonna just put it over top underneath my breast to, for it to communicate to my adrenals. So that's the applying EndoFlex as an example. Another way to support your adrenals and going back to the neck is to apply EndoFlex on your neck, because your thyroid is here and your thyroid communicates with your adrenals. So it's a network, right? I'm applying it over and it's communicating through the network to help support me in whichever area that I'm trying to support myself. And then lastly, we talked about inner thigh. Let's talk about outer thigh, or the back of your thigh. And the reason why I would apply there, again, that's an on location type support. So if I've worked out and I can feel the pain coming, I'm going to pull out my Panaway, and I'm going to put that Panaway in with a carrier oil, and I'm going to rub that sucker on location. Like I'm rubbing it on my muscles. And I'm helping the oils that are within Panaway are a phenomenal support for any pain that you might experience through, exercise, right? So it's going to provide so much support to your muscles. So again, to me, that is considered, applying essential oils on location. And the location this time is muscle. So that was it. I didn't want to keep you guys here long, but I wanted to talk about how applying oils topically can be performed. There are a vast variety of ways that you can apply essential oils. We talked about neck, and that's back of the neck, front of the neck. Back of the neck is your brain stem. So applying essential oils on your brain stem. I didn't mention this, but applying a peppermint as an example on your brain stem when you're going into the gym is like, wake up, right? So you've got your brain stem, you've got the front of your neck, which is your thyroid area. You've got the side and down here on your collarbone, which is a network of lymph nodes. You've got your groin for lymph nodes. You've got underneath your pits for lymph nodes. You've got your wrist. I think I mentioned that, and your forearm, and inside your inner thigh for thin skin. You've got thicker skin. And Bioflex points on your hand and the palms of your hands and on the soles of your feet. You've got your spine, which is used for raindrop technique, but your spine is a network of, is a nervous system connection point. So putting oils on your spine will provide support for the nervous system. There are shoulders for things like valor to boost confidence. Or if you've got, exercise tiredness, then you can put Panaway on your shoulders as well as your thighs. You got your inner ankles. Again, that's more VitaFlex. So there are a lot of ways. You got your abdomen. So there are a lot of ways that you can apply essential oils, and there are a lot of reasons why you would apply them in the areas that you apply them. The goal is just to get them on, though, first. So the oils are going to be effective either way, but to get them on and to ensure that you're putting them on with intention is really important, and where you'll see the greatest benefit. So again, my name is Nicole McFarland of the Oily Ponderosa. Please comment, like, and subscribe to this video, and I'll see you guys for the next video in this series.